Hey guys, right now at the US, over 84 million people are at risk for diabetes, while over 30 million people have it from Healthy Food America. Today, some cities like Philadelphia, Berkeley limited teens from purchasing sugar-sweetened beverages, let's shorten it to SSBs, by exerting an excise tax, which reduces consumption and creates an efficient outcome according to FAB et al. 2016. There is a positive association with SSB consumption and unproductivity according to the CDC. Our children are slowly dying from obesity, and as parents, we must take a stance against those greedy big beverage industries who are not paying for our kids' health by reducing SSB consumption through taxation to the maximum extent of the law. This SSB tax is proven to reduce the consumption, which can limit obesity, benefit policy makers, and increase society's productivity. Our federal, local, and state government should implement more SSB tax to curb the ridiculous rate of obesity. First, consumption of SSBs will decrease because of the tax. In Berkeley, a cross-sectional study found that the consumption of SBS decreased with the excise tax in low socio-economic status countries. Moreover, the additional revenue generated from the tax can be used for a variety of benefits. The revenue is extremely maximized by taxing the volume of SSBs through the use of sales for efficiency, according to Francis 2017. This revenue allows us to fund additional obesity prevention programs, allow us to use more mass media to inform all customers, and subsidize healthy food like apples and kales. Or we can use it to build more playgrounds, increase education funding in disadvantaged schools, and improve our infrastructure, like our tiresome pothole-filled roads in Michigan. In addition, there are significant losses associated with obesity, which can decrease productivity. For instance, the medical cost of obesity prevention, diagnostic, and treatment is approximately $147 billion in 2008 money, according to Bloomfield. However, some opponents might argue the soda tax discriminates against the poor and would not lower all obesity rates. For example, big soda industry argues the tax will make people healthier. Similarly, the soda tax in Philadelphia had people saying, oh my gosh, it affected the people who can't even have 75 cents in their pockets. Oh my gosh. But in the end, this soda fact will not discriminate to the poor, and benefits from the tax outweighs all the short-term costs. Imagine a 1.5 cents increase for each ounce of soda sold. There will be $90 million in revenue for the public, which can be used for universal pre-K recreational centers from the mayor, according to Ken in Philly. Correspondingly, one study found obese people will be affected by the SSB tax, not the poor, regardless of which country of SSB tax implementation. A meta-analysis shows that SSB tax reduced obesity in the US, Mexico, Brazil, and France because of the negative price elasticity. This means as you have a higher price, lower demands. Experts in public health are extremely confident that SSB tax will decrease consumption, reduce obesity and overweightness in the US when our state is facing budget constraints, according to Friedman. All in all, the SSB tax will help our nation combat obesity by limiting added sugar, which is an effective health policy which rewards all the policymakers because it increases revenue that can be used to improve our education, more obesity programs, better infrastructure, lower healthcare costs. As a result, we can have a more productive society and efficient government. Other benefits of this proposal will be for our best interests. As parents, we need to unite now and petition all legislators to create more SSB taxes. As a country, we need to lower obesity. We must fight against the greedy big corporations and do it for our children's well-being. Thank you for my speech.